This video presentation will be on two different screenings. The first half will be about graphesthesia and how to screen for it, and the second will be on nystagmus and how to screen for it. After viewing the first half of this presentation, the viewer should be able to explain what graphesthesia is to a client, describe the causes of an impairment in the populations that are affected, and finally, the viewer should be able to demonstrate the screening process on a client to test for graphesthesia. Graphesthesia is defined as the ability to interpret written letters on the skin of one's palm. Sometimes it is tested with numbers as an alternative. An inability to interpret these letters and numbers is called a graphesthesia. Testing for graphesthesia is a cortical or secondary somatosensory system evaluation, which means that if a person has a graphesthesia, then it is likely due to a cortical lesion or middle cerebral artery lesion. So these are your individuals that have had strokes, multiple sclerosis, or traumatic brain injuries. For the screening process, the first thing you want to do as a therapist is inform the client that you are going to write numbers or letters in the palm of their hand with your fingertip, and this can also be done with a pen cap. Next, you will want the client to close their eyes so they cannot see what is being written, because the point is for them to be able to recognize what is written based on their tactile sense. As a therapist, you will then write 5 different letters and numbers on the individual's unaffected hand. After the unaffected hand has been tested, you will then want to complete the same process with the affected hand. As a note, letters and numbers should not be mixed. For example, writing 2 numbers and 3 letters is not good. Be sure to choose one or the other for all 5. A graphesthesia is present if the patient cannot identify 3 out of 5 of the letters or numbers. Next, you can see how these screenings are performed using letters and numbers.
I'll talk loud. This is Jordan. His affected hand is going to be the left side. So today I'm going to write 5 different letters in the palm of your hand, and you're going to close your eyes and tell me what they are. Okay? Are you ready?
Yes.
First letter.
A.
Yes.
O. L.
I'm looking right now.
G.
Okay, he got 5 out of 5 right on his right hand. Now we're going to move on to the affected hand. It's just pretend you want to figure it.
L. T. E. R.
Okay, Jordan only got 2 out of 5 right on that one. So that shows we have an issue with graphesthesia.
I'm going to draw a number in your hand. You keep your eyes closed. You tell me what number I'm drawing, okay? 5. Good. I'm going to draw another number. 5. Okay. I'm going to draw another number. 9. Very good. And I'm going to draw one more number. 10. Okay, and one more. 5. Very good. Now we're going to draw it over here. Close your eyes. You just have to relax. Just totally relax. And I'm going to draw the number, okay? Keep your eyes closed. 5. No. Wait till I'm done. 9. Okay. Going to draw another number. 4.
Okay, I won't play the rest, but you kind of get the idea. So testing for graphesthesia can be done with both letters and numbers, and they're done in the same fashion. So occupational therapy interventions. Intervention for graphesthesia focuses on providing opportunities for tactile discrimination. Stereognosis and 2-point discrimination are 2 examples of tactile discrimination that the occupational therapist can work on to improve graphesthesia. The therapist grades the intervention by tracing numbers, letters, words, and geometric forms such as circles, squares, and triangles into the palm of the patient's hand. In some cases, the therapist will also have the client write their own name in their opposite palm with their fingertip. Just to summarize the first half of this video, you now know that graphesthesia is the ability to identify letters or numbers written on the skin. You should also know that graphesthesia is caused by cortical and middle cerebral artery lesions. Screening involves testing both hands, and 60% of the letters or numbers need to be correctly answered to pass the screening. Also, keep in mind that from an occupational therapy standpoint, that interventions will focus on providing opportunities for tactile discrimination. For the second screening, we will be going over nystagmus. By the end of this half of the presentation, a viewer should be able to define nystagmus, explain some of the different types and causes of nystagmus, as well as identify the presence of nystagmus using a screening procedure. Nystagmus is a vision condition characterized by involuntary and repetitive oscillating movements of the eye. There are two main movement types. The first is a jerk type of movement where the eyes slowly move in one direction and then quickly jerk back in the opposite direction. The other type of movement is a pendulum movement where the eyes swing back and forth at the same speed. Nystagmus comes in many forms and types, as there are about 45 different types total. The two main types are acquired nystagmus and congenital nystagmus. Acquired nystagmus develops in late childhood or adulthood and is typically the result of central nervous system disorders, metabolic disorders, or substance abuse. Congenital nystagmus usually occurs within the first couple months of life, and is the type where the pendular movement is most likely seen. This type of nystagmus is often associated with other causes, which will be discussed later. Nystagmus results from impairment in the brainstem tract connecting the cerebellum to the extraocular motor muscles. The medial longitudinal fasciculus is the brainstem tract connecting these two, and it is responsible for coordinating head and eye movements. Other causes of nystagmus include CNS diseases and substance abuse, which were mentioned with acquired nystagmus earlier. Strokes, TBIs, and multiple sclerosis are also conditions that could result in acquired nystagmus. Inner ear inflammation, albinism, and high refractive errors such as nearsightedness are often associated with congenital nystagmus. Individuals with nystagmus should have sensitivity to light, trouble seeing in the dark, and a tendency to turn their head to compensate for vision problems. People will also have problems with focusing on objects, tracking objects, and depth perception as well. To screen for nystagmus, the therapist needs to sit in front of the client in a well-lit room. The therapist then needs to instruct the client to keep their head in a fixed position to ensure that the eyes will be doing all of the movement. The therapist will then instruct the client to focus on the stimulus, which will be a bright colored pen cap, while keeping their head still. The therapist will move the stimulus in front of the client in the shape of an H and an X to test all the visual fields, which include the superior, inferior, nasal, and temporal visual fields. The therapist needs to hold the stimulus for a couple of seconds in those extreme visual fields before moving it, because that is where nystagmus is most often noticed. Lastly, as a therapist, it is best to test both eyes separately and then together. Nystagmus will be present if the eye beats back and forth when the eye reaches those extreme visual fields or before. The client may complain of seeing double vision or seeing a blur during testing, which could indicate the presence of nystagmus. Also, an inability to properly perform saccadic eye movements could indicate the presence of nystagmus as well. So what we have next is a video on how to screen for nystagmus. Okay, so this screening is going to be on how to test for nystagmus, and basically what I'm going to be doing is a visual acuity test. So what I'm going to do is I'm going to go ahead and hold this bright colored pen 16 inches away from Susie's face, and what I'm going to do is I'm going to go ahead and make an H pattern and an X pattern to test her visual acuity. And what I'm going to want to do is I'm going to want to hold this pen in those superior field deficits. So her superior field of vision, her inferior field, her nasal field, and her temporal field. And once I get close to those extreme visual fields, that's when I kind of want to see if nystagmus is present by seeing if her eye is beating back and forth. So what I'm going to do is I'm going to go ahead and hold this pen 16 inches from her face. And what I want to do is I want to test both eyes. So what I'm going to do is I'm first going to have her close her left eye, or cover her left eye. And we're going to test the right eye first. Okay, we're going to go ahead and have her close her other eye. We'll do the same thing.
Are there some ways for you to
Okay, and now we're going to have her open both eyes, and we'll do the same thing. So we're going to track to see if they can move together. Are you seeing double right now? Okay, so there was no presence of nystagmus. If there was, I'd see a beating in her eye in those superior fields, inferior fields, temporal and nasal fields. Also, she didn't complain of any double vision, and I didn't see her closing her eye inadvertently when trying to look at the stimulus, and I didn't see any abnormal head movements when trying to focus in on the object. Now, Susie did not have nystagmus, so this video should show what it looks like, and it should give you an idea on what to look for as a therapist. So as you can see, when the eye gets to those extreme visual fields, it starts to beat back and forth at a rapid pace. Hopefully you should now know that nystagmus is a vision condition characterized by jerky back and forth movements. Again, there are a multitude of causes contributing to the main two types of nystagmus, acquired and congenital. And you should now understand that screening for nystagmus involves use of the same screening for visual tracking. These are our references, and thank you for watching.